All right, we're going to go over the discharge instructions for the TPLO with the internal brace suture. So your dog's coming home with a bandage in place on the operated leg. So I'm just going to walk through these discharge instructions so you'll have a video reference and you'll also have it written down. But most importantly, I've included the office phone number and my cell phone number in the discharge instructions. So during office hours, you're having an issue, I want you to call the office number. But if it's evenings or weekends, feel free to call my cell phone number, shoot me a text, whatever you want to do to get in touch with me. But for the next 6 weeks, at least, we're going to limit activity to 1 or 2 rooms of the house. I don't want them to have free access to the house, and I don't want any running, jumping, or rough play. Everything's nice and slow on the leash. Now, the slower we make him walk, then the more off-balanced he is. He's going to be using his leg better. The tendency when these dogs have this soft cast on their operated leg is for them to wing it back and kind of hold it back and just kind of drag it behind them. If we make them go super slow, they'll start to pull it forward and place their foot normally as they're walking. That's what I want us to work on for these next 2 weeks. There is a skin incision. There are no sutures, but the incision's covered by the bandage, so there's nothing for you to look at for the incision. The bandage needs to stay clean and dry. Dry is the important thing. We don't want it to go outside and get wet, either with urine or wet grass. So we're going to send you home with a protective cover. Use the cover when you go out. For bathroom breaks, when you come back inside, take the cover off so that the bandage can dry. Now, the cover can get washed in the washing machine if you need to. If there's a sudden change in the bandage, like all of a sudden we smell something that we didn't before, or we're chewing at it when we didn't before, that usually means there's a problem. You should give me a call. We are sending you home with an e-collar to prevent him from chewing on the bandage. All right, we don't want the bandage to get wet with saliva either. X-rays of his knee will take at 6 weeks. We'll schedule that when you see you back in 2 weeks. So the first thing we need to do is see you back in 2 weeks. We're going to take the bandage off. We're going to feel his knee, and we're going to talk about starting a walking program. Medication-wise, we have 3 to come home with. Carprofen or Rimadyl. It's an NSAID, okay? We're going to give that every 12 hours for discomfort. Here in the hospital, we dose things on a 6 and 6 schedule, so the next time he's due for the carprofen will be 6 p.m. Now, if you notice any change in his appetite, vomiting, diarrhea, we want you to stop the carprofen and give me a call. The second medication he's coming home with is gabapentin. It's a human drug. It's for nerve type pain. I think it works pretty good in conjunction with the Rimadyl. It can give every 8 to 12 hours. Here in the hospital, we do it every 12. But if you think he needs a little bit more once we get home, you can give that on an 8-hour schedule as well. Again, at the hospital on a 12-hour schedule, 6 a.m., 6 p.m. And then the other thing is an antibiotic, cephalexin. We're going to give that as well twice a day with food, okay? And you're going to give the antibiotic, the cephalexin, until it's all gone. And it also is a every 12-hour drug. Again, if you have any questions, feel free to give me a call.